Researchers in New Zealand and around the world are working hard to unravel the mysteries of Alzheimer's, a disease in which waxy plaques and tangled threads of protein crisscross the brain, leading to devastating mental decline. The Neurological Foundation has brought one of the world's leading clinical researchers in the fields of memory and longevity to New Zealand as a lead-in to Brain Awareness Week. Dr. Gary Small is the director of the UCLA Longevity Centre at the Semel Institute for Neuroscience and Human Behaviour. He is also the Paolo Solomon Professor on Ageing at the David Geffen School of Medicine. For more than 20 years, Dr. Small has been studying Alzheimer's disease and Alzheimer's disease prevention in his clinic with patients. He has shared his remarkable findings in his best-selling books and in frequent media appearances. In this interview, Dr. Small will share with broadcaster Jim Mora that while he is optimistic that researchers will find a cure for Alzheimer's disease, for now the most promising path is prevention.
First of all, Gary, we kind of think we know, but I don't think we do. What is Alzheimer's disease really?
So Alzheimer's disease was actually defined over 100 years ago when Alois Alzheimer had a patient who was 51 when she first got ill. She died in 4 years. She became very confused, out of touch with reality. And what Alzheimer did was to look into her brain, and he saw these abnormal protein deposits called amyloid plaques and tau tangles. And they collected around the areas of the brain that control thinking and memory. So that's basically the definition of the disease. The medical community didn't take much note of it because they thought it was a very rare pre-senile dementia, only affecting a few people early in life. But in the late 1960s, pathologists found that people who were older, who had what we called senility, when they died, they had the same plaques and tangles in their brain. So now we have this epidemic because age is the greatest risk factor. So as you get older, you're likely to feel these losses in memory and thinking. And in the brain at autopsy, we see the plaques and tangles.
We know there's predisposition, we know there's heredity involved. To what extent?
Heredity is important, but for the average person, genetics is actually less important than non-genetic factors. And that's a surprise to many people because we know that Alzheimer's is a physiological brain disease. I mean, there are real abnormalities in the brain. But the wake-up call for many of us is that you can have some control over that brain disease based on your everyday lifestyle choices, whether you exercise or not and eat right or not.
Can I ask you more about that because it's so crucial, and yours is the latest research on all of this. First of all, these environmental factors that most of us think, yeah, exactly what are they though? What are they in general terms? What will make the difference?
We don't have all the answers, but there's been extensive research looking at physical exercise, mental stimulation, diet, whether you can deal with stress properly, and other related behaviors that appear to stave off the development of symptoms in Alzheimer's. And we can go one by one on each of those areas, and we can talk about how it impacts your brain.
Some of it's, I guess, common sense, or has become so now, and we kind of mostly understand what a good diet is. Not too fatty, lots of green vegetables and fruit, etc. But they have specific actions, for example, if you're talking diet, on the brain, don't they?
Yeah, probably the most important aspect of diet is to not eat too much. Overweight and obesity is not good for the brain. In fact, if you're overweight, that doubles your risk for Alzheimer's. If you're obese, that quadruples your risk. That's the bad news. The good news is that recent studies show that if you can lose weight, your brain gets better. There was a study where they had a group of obese individuals who underwent bariatric surgery to help them reduce their weight. And after 12 weeks, they had significant improvements in their memory abilities.
If there are older people watching this and are a bit resigned to their fate, one interesting thing in your book is that you can regain elasticity at advanced ages to a certain extent, can't you?
Yeah, I always say it's never too early and never too late to start protecting your brain. In fact, if we take physical exercise, some of the greatest benefits in physical exercise are enjoyed by seniors, not just middle agers. So you don't want to go out there and become a weekend warrior and injure yourself, but I think getting started at any age on an exercise program is very important for brain health.
What do you do personally? Because that, I would think, is a really good yardstick for what the rest of us should do.
Well, I'm doing so much that I only have like about 2 minutes a day to even work. So I'm practicing what I preach. And that actually isn't true. It doesn't take that much time to protect your brain, to live a brain healthy lifestyle. So what I try to do is eat healthy. So I have smaller meals throughout the day. So I'm kind of a grazer. I'll have breakfast, lunch, and dinner, but also mid-morning and mid-afternoon snack. I'll try not to consume too many processed foods, refined sugars. I try to emphasize the healthy fats, omega-3 fats from, say, fish, minimize the omega-6 fats from red meat and whole milk products.
Yeah.
I exercise every day. I take the stairs. I don't always have time to go to the gym, but I'll walk briskly between meetings. And I even go to the gym 2-3 times a week for strength training, because there's evidence that strength training offers additional benefits beyond cardiovascular conditioning. And then also I try to remain social. Loners don't do well, not only in terms of brain health, but in terms of longevity. So I'm always talking to friends. When I can, I stop answering all those emails and I walk next door and have a conversation with someone. And stress management is very important. In fact, my wife and I have started to meditate every day. There's very compelling research about meditation. And there are these apps that you can use on your smartphone that gives you a guided meditation. We're doing that every morning together. It's brilliant.
A lot of this is in your book, but when you say meditation, do you mean that kind of in vogue mindfulness type meditation now?
Yeah, you can call it mindfulness. Herbert Benson called it the relaxation response. And there are many ways to get your mind in that state. It's not that difficult to do, although I must say a lot of Westerners don't like to meditate. They prefer something like Tai Chi, which is a bit of a meditative experience, but it also involves physical movements. And that too has a tremendous benefit for brain health.
Even getting outdoors is a reasonable substitute for that, isn't it? Being in an environment that's going to relax you and focus you on what's around you.
It's interesting you mention outdoors, because there have been studies comparing walking on a treadmill indoors versus taking a walk outside. And you know the result. Walking outside is better. And it may be just seeing the sights and the extra stimulation or something else we don't know about has an additional benefit.
Speaking of bits of research, and I'm sure people have seen them and find them confusing, whenever a scientist discovers some incremental thing about Alzheimer's or thinks he or she has, it's reported and it starts to bamboozle us, like have an extra cup of coffee a day, it'll keep your brain sparking. How much of these gradual revelations should we take notice of, or should we just concentrate on your general prescription? What's your view of that?
So I think it's challenging. It's not only challenging for the lay person, but for scientists as well. There's so much information. You know, one day we're saying take vitamin E. The next day we're saying no, don't take it.
Yeah.
And that's actually one reason we wrote the Alzheimer's prevention program, is to try to take that research and put it in perspective. So I think when people hear about the research, yes, take notice of it, but try to understand it. Have conversations about it. Talk to your doctor about it. Call you on the radio and try to put it in perspective.
When you're doing all that, I'm just looking at that brain sitting in front of you. When you are reversing that process that might lead you into dementia or Alzheimer's, what's happening in that brain that is starting to fix you or stave off the development of deterioration?
Well, we don't have the complete answer to that, but there are some studies that help us approach the answer. For example, we talked about physical exercise. The scientist at the University of Illinois, Arthur Kramer, has done extensive studies where he takes older adults, puts them on a walking program, compares them to a control group that just does stretching and toning. And he finds the older adults are better at complex reasoning, they're better with paying attention, they have better memory, and he studied the size of their brain, especially a part of the brain underneath the temples called the hippocampus, which is a very important area that forms our memories. And the longer you walk, the bigger your hippocampus. So your brain gets bigger, and a bigger brain is a better brain. So there's in the United States, an insult is calling someone a fathead. It's actually a compliment.
The scary part of your book for me was seeing the tests that you lay out, which are really valuable, but they give us indications about our brain state, including memory, speaking of the hippocampus. And I'm just wondering, some of them seem quite indicative, don't they? And I think you mentioned in particular being presented with 10 words on a piece of paper and taking a minute to memorize them and then seeing how you go 10 minutes later. When you get into this kind of specific area, how many clues do we get about susceptibility to Alzheimer's later, do you think?
So I think, I don't mean to scare people by the tests, but really they're aimed to show people where they are right now. And it's really a way to show them how they can improve. Because the Alzheimer's prevention program is in part about strengthening your brain cells, making them stronger physiologically, but it's also teaching people techniques to compensate for their age-related memory loss. So what people who read the book can find is that, well, they may only get, say, a 4 or 5 on the first test, but after they learn the methods, they do much better. So it empowers them, and I think that's very important to motivate people to take care of their brain health, to make a little bit of an effort to do the right thing. Now, as far as how well it predicts whether you're going to get Alzheimer's, taking an assessment in the book, it's not going to really tell you what you can learn from going to the doctor, because it's very difficult to differentiate normal aging, the forgetfulness we all experience, where did I put my keys, or where did I park my car, what's that person's name, differentiating that from something that is going to be a bigger problem in the future.
You're quite reassuring actually about those things. I walk into the kitchen, where did I put my keys? What did I come in here for? Who's that person that I've just met? I really need to know their name again, which worries all of us. Yeah. But you're quite reassuring about that to an extent. That's part of just aging, some of it, isn't it?
It is part of aging, and the scientists have found that by age 45, the average person has a memory that's not as good as it was when they were 20. And so it's gradually changing. In fact, we did a recent study with 20,000 people across the U.S. We engaged this organization, Gallup Poll, and we found that even people in their early 20s are beginning to complain about their memory. So this is something that is a lifelong process. And I've even argued that all of us have Alzheimer's in our brain. Those plaques and tangles are building up very slowly over a lifetime. And the goal is to slow that buildup down so we don't have problems.
It's interesting because you can do certain things and you might slow it down by 2 years or 4 years or even shove it out longer than that. Out of interest, after your 20s, when your brain is no longer in optimum condition, is it a good idea to adopt your regime then? Not wait till you're 50 or 60 or 70. Could we actually achieve quite startling brain health at the end of life towards those latter years if we did that earlier?
I think it would be a great idea. In fact, my kids were growing up, I always went to their schools when they were very young and taught some of this information. I'd be a guest lecturer for these 6-year-olds. And my son reminded me, hey, Dad, broccoli's good for your brain. So when you start early, you create those habits at a young age, and it's very easy to continue. Now, the problem is, when you're young, you're not motivated.
No.
People are motivated when they start becoming forgetful. And in fact, that large Gallup poll study, we found, interestingly, that the young people in the study, their lifestyle habits were worse than the old people. In part because if you smoke and you drink and eat in excess, you're not going to live to 75 when somebody calls you up for a phone interview. Your life expectancy is going to be shorter. And also, as we get older, our doctor will tell us, well, you've got to watch your diet, or you've got to lose some weight, and you start listening and you change your lifestyle.
Speaking of being young, this is a regular topic in New Zealand, probably too in America where you have American football. Concussion injuries from our rugby, very common, to a lesser extent football, soccer. Would you go so far as to advise younger people against these kinds of sports, knowing what you know now about the effect of trauma later on the brain?
I would, but I know not everybody advises that. Some of my colleagues who I've worked with in the head trauma area don't recommend that, because they know a lot of these kids, it's very important for them to be in sports, and they're getting a lot of exercise. So it's not a simple answer to this. And I think probably instead of abstaining from the sports, trying to find ways to make it safer. And that's already beginning to happen, where they're trying to minimize some of the head contact and trauma that results from some aspects of these sports.
If you were a top sports person though, and you'd had say 5, 6 concussions, would that be a sign to a doctor like you to seriously rethink any further career? In other words, is it such a risk factor that if they were coming to you to talk about it, you'd say, hey, listen, think twice about whether you want to keep doing this?
I might say that. I'd want to find out more about the sport and what it means to them.
Sure.
And we also know from our own studies there are people who have what's a lot of tauopathy, or that tau protein in their brain, who have been professional athletes. And despite that, they don't seem to have a lot of symptoms. So it's more than just the head trauma that is leading to the symptoms. There's probably genetic factors and other things we don't understand.
Speaking of genetic factors, you're more at risk, aren't you, if there is Alzheimer's in your mother's family history? Is that correct?
Well, it's not just the mother's side. If you have what we call a first-degree relative, a parent or a sibling with Alzheimer's, that will at least double your own risk. And the research we've done and others have done have found that there's a particular gene, they call it ApoE, and 20% of the population has a form of it, ApoE4, that increases risk for Alzheimer's. And that's probably what's being inherited for the average person. But there are other risk genes that we're learning about. Now, the thing about risk genes, it's not an absolute. It doesn't mean you're necessarily going to get the disease. It just slightly increases your risk. So we generally don't recommend that kind of genetic testing as a predictive test.
Because it would just worry the person involved.
And in fact, it does. There have been studies showing that if you take people who have normal aging, so they don't have dementia, and they have ApoE4, the risk gene, and you tell them about it, if they take a memory test, they do worse than another group that wasn't told.
And also they worry when it turns into depression as some kind of indicator for Alzheimer's, isn't it?
Yeah, but it is confusing, because there have been other studies showing that when you tell people about their results, they don't necessarily get more depressed or less depressed.
No, it's a complex area.
Yeah.
So what could someone do who's getting advanced in years? Would a regular MRI scan identify the plaques and tangles in the brain and be a useful kind of indicator of what you need to do to reverse it? What would you recommend there?
So I think at this stage, routine brain scan screening doesn't make sense. And in fact, I've been working in this area for many years, have co-invented the first brain PET scan that actually shows in living people the plaques and tangles. But I don't recommend that routinely as a screening test. And there are others that show plaques, and a lot of people are getting their scans, but the problem is what does that information add to your future? How does it help you? We talked already about the anxiety and the concern that it can raise. It isn't until we get one of these scans to be linked up to a specific treatment that it will have an impact. Just like you get a cholesterol test at a certain age. If your cholesterol is high, you take a statin drug to lower your cholesterol and lower your future risk for a heart attack. We're not quite at that stage yet with Alzheimer's.
How soon? Because everybody's desperate to know, aren't they, what will be remedial in the years ahead and have efficacy for people. What are we, do you think, on the verge of in terms of treatment of Alzheimer's?
So that's hard to answer because I tend to see the cup half full. And over the years, I realize it can be half full, but as you get closer to your endpoint, it kind of gets a little bit emptier. And there's a lot of promising approaches right now. I was at the International Alzheimer meeting last summer, and there were several drugs that were in the pipeline that looked promising. Mm-hmm. They didn't seem to be cures, but they did seem to add value to the current medications. And it suggests to me, at the very least, in the next few years, we'll have several more medicines, and we may be managing Alzheimer's much in the way we manage other chronic diseases like diabetes, where a patient may go on several different medications that might be combined with a healthy lifestyle. And in the meantime, we're hopeful that other innovations will make a difference. We're studying, for example, deep brain stimulation, so using devices or ultrasound to activate certain neural circuits in the brain just by sitting in what looks like a hairdryer or a coil, and that may have an impact. And there are other innovative approaches as well.
I suppose if you or I make age 110, at the moment we're going to have probably some enfeeblement or, if not definite, Alzheimer's or dementia. Can you see a future for our grandchildren where they might live to 140, who knows, and still be crystal clear in the brain department? Is that what, because that's what we hope for, isn't it?
Well, I hope for that, and I could see that future, but to me it's not science. It's still science fiction.
That's optimism.
It is, well, yeah, because what you see in science, I'm sort of an agnostic when it comes to science. I don't know. I've got to do the experiment, and deciding which experiment to do is based on, looking at all the studies that have been done, hunches and so forth, but we'll never know until we do the experiment. And it's really having a hypothesis, doing a study, seeing if it's positive or negative, and then seeing if somebody can replicate it.
You said something quite shrewd before about how we can know what to do, but we don't necessarily do it. If you could choose just one of what you advise, one of the things you advise in terms of lifestyle change, human nature being what it is and everybody still wants to eat their bacon for breakfast, etc., what would that one thing do that's going to have most efficacy for most people? Is there such a thing?
So, the simple answer is physical exercise, because there's been the most studies with that. But I would hedge. I like to tailor the program. So if I am seeing someone who's really stressed out, maybe they should join me in that morning meditation,
right,
because that may have a bigger impact than the exercise. If somebody's overweight, midlife obesity or overweight has a huge impact on risk. So maybe getting that person on a diet or getting them to exercise and a proper diet.
Does diabetes, by the way, indicate you're at increased risk?
It does. People with diabetes have double the risk for Alzheimer's. And it's interesting, if you look at the main methods in the Alzheimer's prevention program, 2 of them will prevent diabetes: physical exercise and a proper diet.
So from an inference from what you're saying is that Alzheimer's is actually a disease that results from holistic failure, if you like, the failure to live well, eat well, keep yourself stimulated, all those things. Would that be fair? Actually, it's a fairly, despite its complexity in the brain, it's a fairly simple disease in that respect.
Yes and no, because yes, that is true. On the other hand, genetics are important. There are other factors we don't understand. A lot of us think that inflammation is a big issue. So inflammation is really this system in your body that kicks in when you injure yourself or you get an infection, and it repairs the damaged tissue and so forth. So if you sprain your ankle, it'll get red, it'll get swollen. That means your inflammatory system is working right. Now the problem is as we age, or if we're overweight, or if we have a bad diet, or we don't get enough sleep, or we don't exercise enough, we have too much inflammation throughout our body and our brain. And so a lot of the studies show that if you can reduce that level of inflammation, it actually is brain protective.
To what extent can you reduce that level of inflammation with the so-called anti-inflammatory foods? Can you tell us?
So I think to some extent you can. So omega-3 fats of fish oil, that would be anti-inflammatory, and it does have some impact. The studies show that, and for some people it can have a huge impact. But in terms of trying to get people to do the right thing, we found in our programs that's one of the toughest things, is to get people to change their diet, because they've got to go shopping, they've got to get different food, they've got to learn to cook differently, but when they do it, they thank us.
Is there going to be an Alzheimer's epidemic, which is the phrase that, trips off everyone's lips? Or in fact, with books like this, with your book, are you going to turn that around? What do you think the state of play is?
Well, if we can sell enough books today, maybe we could make a difference. The statistics tell us that by 2050, we're going to have 3 times as many victims of the disease. That's the bad news, and it's going to overwhelm the health system and caregiving system and so forth. But there is a glimmer of hope that things are changing. There have been some studies in Europe showing that the prevalence of Alzheimer's disease today is actually lower than was predicted. And it's especially in countries where there are wealthier countries, a higher socioeconomic level. So the thinking is in those countries where there's more education, where people understand the connection between behavior and brain health, that it's starting to make a difference.
When you talk about personalising treatment, if someone were to come to see you, and that's a very sensible response, that also depends on what they do, not just who they are and what their lifestyle is like, but the jobs they do. Because you want to stimulate the parts of the brain and energise those parts that they wouldn't normally use in part, yeah?
That's true. So if you have, let's say, a busy executive who has lots of mental stimulation, that's not going to be a big part of the program. That person probably needs more time to relax and to reduce stress. That person probably needs to find ways of integrating physical exercise into his or her daily lifestyle. So they may not have time to go off and run around the track, but they can learn to choose the stairs instead of the elevator and try to innovate in that way.
So even those kind of incremental improvements in what you do physically are valuable. You don't necessarily need to set aside the 45 minutes for the gym 3 times a week.
Oh, that's true. I mean, one study, or actually several studies now, have found that the amount of time you spend sitting is associated with how much Alzheimer's is in your brain.
That's very depressing news for a lot of people.
Maybe we should both stand up right now.
Because that would be a problem for you, I'm intuiting too, wouldn't it?
Well, I sit a lot, but I get up and I stretch and I walk around and I do whatever I can to counteract that. And what a lot of people are doing, they're innovating with their workstation. They'll have a desk where the computer is high up, or some people even have a little treadmill where they walk on the treadmill slowly while they work. But you have to be careful when you start that, because it's a form of multitasking you have to train your brain to do right away.
Does Alzheimer's still baffle you? You read about the people who get it, brilliant people like, say, Iris Murdoch, the writer, and you scratch your head and you think, it's a bolt from the blue with some people. It's still a mystery, as well as everything you've clearly explained to us. It's still got mystery to it as well, hasn't it?
It is baffling. I mean, we haven't figured it all out yet, but that's true about many age-related illnesses. We're making progress, and I think the progress is in part due to greater emphasis on the funding, because we have a lot of smart people around working on it, doing some brilliant research, but you can't do the research unless there's funds to do that. And so I think if we can continue to get serious about it, invest in trying to understand and create new ways of identifying it early and also treating it with more effective therapies, we're going to make a difference.
I'm conscious that people looking at this, at our chatting online, some of them will simply be interested, some of them will be worried, won't they? Personally worried, or for relatives or friends. What, just a closing remark from you maybe, what would your message be to people who are worried about their mental state, whether they might be in line for Alzheimer's? What would you say to them?
Well, the first thing I'd say is don't worry, because if you worry about your memory, you actually will do worse on memory tests. And the best way to overcome that worry is to learn and find out and get some education about it. And certainly the Neurological Foundation here has a lot of important information. There are Alzheimer's associations and societies, but also going to the doctor. If you're concerned about your memory, contact your doctor, find out what's really going on, because there are a lot of things that can affect our memory capacity. It can be a medication side effect. It can be a physical illness. Sometimes it's treatable. And even if it turns out to be Alzheimer's, the earlier it's detected and the sooner you get on therapies, the better the outcome.
And most general practitioners are sufficiently up to date with the kind of information that you've updated in your own book to know this stuff?
That depends. I mean, when I went to medical school, we had an hour on Alzheimer's disease, and that was it. But I think it's gotten much better. But I think that, we're all getting very sophisticated and informed thanks to the World Wide Web and the exchange of information today. So I think that you can get the right kind of education from your doctor to start out, and if it has to be taken to the next step, you could certainly see a specialist.
Good to see you in New Zealand. Lovely to meet you, and it's a very valuable and important visit for a lot of people. So thank you for coming down here
My pleasure. Thanks for your interest.
and talking to us.